Gotta get my laundry done today.
Hey, Tanner, you ready for the anatomy?
Caitlin! Well, she won't remember anyway.
Caitlin! Hello? Are you okay?
Where am I?
Here, let's get you up.
I don't
Come
know.
on, can you sit up?
What am I doing?
What you need? Oh! All right, here, we'll go into my office. Oh! The signs and symptoms of a concussion can be separated into short-term and long-term. Every concussion is unique, and each individual suffering from this injury will have a different reaction due to their affected anatomy and physiology. The short-term signs and symptoms include, but are not limited to, headache, nausea, vomiting, dizziness, fatigue, abnormal sleeping patterns, drowsiness, and pupil dilation. It is important as a clinician to evaluate the patient for these effects as soon as possible. Some long-term deficits include, and again are not limited to, impaired memory and attention, changes in executive function, emotional instability, and sensory motor deficits. These patients should seek out proper treatment for the best outcome.
Brain tissue is soft and has a consistency like that of warm butter. This consistency is in part due to fatty sheaths called myelin, which wrap around many cranial nerves. Myelin is responsible for insulating nerves, which allows electrical impulses to travel quickly throughout the brain for proper function. In addition, the brain is divided into 4 different lobes: the frontal lobe, parietal lobe, temporal lobe, and occipital lobe. Each lobe of the brain is responsible for distinct and essential functions. Because the brain is so vital to our survival, it is well protected. Hard, bony tissue called the skull surrounds the brain. Another layer of protection consists of the cerebrospinal fluid, or CSF. The brain floats in this fluid, which acts as a kind of shock absorber to protect against impact. Sometimes, however, an impact to the head can be so great that the brain crashes into the skull, resulting in a concussion.
Concussion is one of 8 different types of traumatic brain injuries. Trauma to the head causes the brain to bump into the interior of the skull at the point of impact, called coup, as well as on the opposite side of the skull, called contra coup. This results in contusions that damage 2 sites in the brain. Some nerve fibers can recover from such damage, but more severely injured nerve fibers can permanently lose their ability to send signals and communicate with other brain cells. Blood flow to the site of injury is also reduced, which hinders the delivery of oxygen and nutrients, leading to long-term symptoms.
Buddy on the field, your fate is sealed. A blow to the head is every athlete's dread. Your brain goes crashing into your skull. Despite CSF, it still takes a toll. We will watch you. We will watch you.
Buddy, you're a boy, hit your big head, now you got a concussion and you gotta stay in bed with blood on your face, perivascular space, inflamed cause your brain's all over the place.
We will inspect you. We will observe you.
So feeling kinda dizzy and a little nauseous, add a pounding headache now, be more cautious, a little bit dazed, don't be phased, wait some time, you'll recover just fine.
You will recover. You will